compounding pain gels for about 25 years. We've been working with several physicians in the local area and throughout the United States on developing gels that are customized for the individual patient's needs. A lot of times we can put in the gel, we can put an analgesic, an anti-inflammatory, an antispasmodic, something as simple as a muscle relaxer, some lidocaine for some anesthetic. A lot of times this gives a physician a way to actually customize that gel, that pain gel, for the individual patient. We've developed several gels working with physicians, and each physician has a name that they like to put with it, so it makes it easy for them to call it. And we've kind of tailored a name, Ultraflex. So a lot of physicians will use the name Ultraflex for the customized gel, or Neurogel is another name for the gel we use that has nerve involvement for neuropathies and things of that nature.
Well, I'm a podiatrist here. My name is Dr. Shadowski, Paul Shadowski. I've been in Kingsport for 15 years now. I've been in practice for 20 years. I'm board certified by the American Board of Pediatric Surgery. I see a lot of diabetic neuropathy in my practice, and over the years this has been a real difficult thing to treat. It's a great mix. We found this to be the only effective treatment, really, topically, in our practice, and it's been very useful. We've tried it now on about 3 dozen patients with great results in probably about 95% of those patients. So we're really pleased to say good things about the Neurogel Plus.
My name is Tom Rogers. I'm a physician at Performance Medicine. I've been working with custom compounding for about 4 years. And I'll do a lot of sports medicine. I do a lot of hormone replacement, a lot of fitness, nutrition, weight loss. I use a lot of the Ultraflex for back injuries. I had a patient today that was applying it every 2 hours. He had strained his back while mowing the yard. It worked fantastic. His quality of life is now normal. I've actually used this on my son, who's a professional tennis player, plays tennis all over the world. And he, of course, has sore shoulders all the time and uses it. His friends use it for acute muscle strain on shoulders and elbows. It works within a couple hours, and it's really helped him amazingly well on the tour.
When I was younger, a young doctor, I used to believe that my patient's arthritis pain was nothing to be considered. It was a minor problem. I didn't realize how depressing it was to have arthritis until I developed it in my late 40s and early 50s. By that time, I was very sympathetic to my patient's needs. I also understood how difficult it was to take non-steroidals because of my own problems with acid reflux. I can use this multiple times during the day with minimal side effects and with no worries of complications to the rest of my body parts. So I prefer using a compound which is made specifically for me, tailored to my needs for my pain, and not have to worry about whether or not I'm going to be up all night with acid reflux or if I'm going to have edema in my legs the next day. One of the great things about Ultraflex is that it has a variable number of compounds. And you can have all 5. You can have different strengths of any of the 5 ingredients, or you can have only 1 ingredient, or 2, or 3, or 4, or 5, whatever your patient needs. And your doctor or the druggist at Custom Compounding Center of America can tell you what would be most appropriate for you, given your medical history.
From the beginning, I was introduced to Custom Compounding Pharmacy and their various arthrogels, Neuroflex, Ultraflex, and the various patient types that could benefit from the compounds. And at first I was skeptical. Who wouldn't be? A gel that will actually fix something rather than a pill? Okay, come on. Well, after trying it and introducing it to several of my patients, I've seen beneficial results. Now, not only are they coming back happy, but requesting it again. I had one gentleman that came in on a Friday, and I unfortunately just could not work him in that day. He needed something for his shoulder pain. I thought, well, okay, we'll give him some Ultraflex. He returned to the office on Monday. I was prepared to give an injection. As I walk in the room, I'm greeted with a smile, and he says, "Doc, I don't need that shot. That stuff worked."
I have had patients come in to the office requesting this topical pain medication, Ultraflex, without me bringing it up first in conversation, and I have used it with wonderful success. It also is a great alternative to taking medication by mouth. There's less side effects in that regards. It's also a great alternative as a starting point, even if you have taken over-the-counter anti-inflammatories or pain medication and you're not getting a lot of success with that. It's a great alternative to injections, and I've used it post-op for surgical incision pain, where patients have had a surgery and they're having a little bit of pain after that, and it works wonders.
I've had some patients have tried some of the other commercially available topical anti-inflammatories and have found that they've liked the Ultraflex better. Of course, the ingredients are a little different. You guys have other added benefits, I think, in your gel that the commercial anti-inflammatories do not have. And I think that's a benefit to patients. Also, the neurogel has worked well in our patients. I've used a few with patients with post-herpetic neuralgia, and that has worked well. I had one patient in particular that we used the neurogel on, which of course differs from the Ultraflex by the way that it has the Neurontin or gabapentin topical medication in there. And she was having a lot of pain from lingering shingles, which we call post-herpetic neuralgia, so a lot of burning, stinging pain, and that tended to work very well for her, better than the oral nerve medication she was taking. I think it's great for a lot of patients that can't tolerate oral anti-inflammatories due to stomach issues, patients being on Coumadin or other blood thinners, they're worried about interaction with that. They can use the topical Ultraflex and get a great result. It's the pharmacies close by. We compound it right here. They get a free 10-day sample, which is great. Patients love to be able to try it before they get the prescription. And they like that you guys follow up with them. They really mention how you follow back in about 2 weeks to find out how they're doing, and they appreciate that.
The pain gels that we prepare here in our laboratory at our pharmacy do require a prescription. If any of this sounds like it may be something that we could help you with, please give us a call at our pharmacy here in Kingsport or in Johnson City, or you ask your physician about it. We'd be more than happy to discuss it with them.
Professionally, Neurogel Plus is really the only topical effective medication that I've found for diabetic neuropathy.
As a doctor working at Performance Medicine, I can definitely recommend that you use the custom compounding gels. They work.
For chronic pain, I recommend the use of Ultraflex for arthritis in any part of the body.
As a physician, I am more than happy to recommend Ultraflex to my patients because I feel that it does work.